Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is a show about your total health from the top of your head down to the bottom of your feet. I personally am a periodontist. I'm a dentist and I treat gum and bone disease. Actually, in my practice is a little bit unique. I treat patients from 4 days old to almost 100 years young. But we're not here to talk about what we do here. We're here to talk about a subject tonight that's real important to a lot of people, their pets. Now, in my pocket, I happen to have a photograph of my buddy Jesse. Jesse was my soft-coated Wheaton, and he's probably gone now almost 8 years, but there's a picture of him in my office and one right next to my bed, because dogs are wonderful emotional companions for people. So tonight I have with me Dr. Steven Bromberg. Steve, welcome.
Thank you, Kenny. How are you?
I am terrific. I'm so glad you're here. You know, we met at a meeting and I look across and you said your name, and I said, you look so familiar, and actually years ago I took care of your mom and dad and you look just like your dad. I'm so glad you're here.
Thank you much.
Tell me a little bit your background. Where are you from and how did you decide to become a veterinarian?
Well, I'm from the Jersey Shore, Seaside Heights, which is well known after Hurricane Sandy, unfortunately. Right. And that's where my father had his drugstore, and growing up there weren't a lot of kids my age, so my best friend was my dog. My dachshund Dino, named after the Flintstones dog, and Dino lived outside and brought home all kinds of creatures for us to play with. He brought home Tortuga the turtle, he brought Harry the wren, and they were injured, and I asked my mom if I could take care of them, and lo and behold, it bloomed a career.
It's interesting because I was a psychology major in college, and my dad was a dentist, and first I was going to be a physician, but then I realized, you know, I liked what we could do in dentistry, so I went to dental school at University of Maryland, then went to my perio training at Penn. So I'm probably older than you, so I was probably long gone by the time you got there. You came to Florida, and did you establish your own practice then, or were you working with other doctors?
I worked, well, as you know, getting your degree is your license to learn.
Right.
And I practiced with 3 other veterinarians for about 4 years prior to opening up my own office. I did some relief work in Coral Springs one day for a veterinarian on vacation, decided this was a nice community for children, nice place to raise a family, decided to move here and open my practice. So I opened up Sample Road Animal Hospital in 1981, and I was the 3rd veterinary practice in Coral Springs, was voted veterinarian by the Forum of, best veterinarian for 2002, 3, and 5, and enjoyed a single practice up until this past June, where I decided to merge my practice with a larger facility a mile down the street, and I now am an employee at Coral Springs Pet Center and Pet Resort and Medical Center.
Gotcha. Now, you don't treat horses and cows and elephants and giraffes in your facility. What type of animals do you see?
No, it's a small animal practice, which basically means anything you can carry in the door we can take care of.
Got it. Okay. You know, I've always been amazed at the variety of things that the veterinarian can do. They can go from doing, well care to illnesses to veterinary dentistry to plastic surgery. I know a friend of mine had a Shar-Pei, and the veterinarian actually did a blepharoplasty so the Shar-Pei could end up seeing. So you're pretty much a general physician, surgeon for the entire animal, is that right?
Correct. I'm a general practitioner, which I personally enjoy. There was not much of a market for specialists when I was in school 35 years ago. In today's world, as you point out, there are veterinary dentists, veterinary cardiologists, veterinary dermatologists, neurosurgeons. There's nothing that can't be done to treat our animals that can't be done for ourselves. Some of the hospitals are huge and have all these specialists on staff. We're very fortunate in South Florida to have a specialist within an hour's drive in all directions.
Right.
But as a general practitioner, we used to do a lot of that ourselves. Now we seek the specialist help for a lot of these areas, such as canine dentistry, again, as you point out.
You know, when I was in perio school at Penn, one of the root canal graduate students was called to the Philadelphia Zoo because one of their prize tigers had a toothache. And they found out the tiger had an abscess, and they had to design special instruments so they could do a root canal on this tiger. And I know in large animals, whether they be cattle or horses, that dentistry is a big deal, because if an animal has a bad tooth or oral infection, then it's a financial problem for them.
Absolutely. As you know, the mouth is the gateway to a lot of health issues in the human body and in the animal body as well.
Okay, you know what? We're going to get back in just a moment. We have to break. It's Dr. Kenny Levine with Health Talk. We'll see you in just a moment. Thank you.